Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the 7th video of rapid revision course of oral and maxillofacial surgery, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about space infection or facial space infection, are also known as facial spaces. Now we will discuss about definition of facial spaces or facial space infection, then types and each type's detail. Now first, facial spaces or facial space infection are potential spaces that does not exist unless there is an untreated spread of infection. When there is an untreated spread of infection occur in that area, due to this spread of infection there will be facial space infection, which is known as facial spaces. Now come to the types of facial spaces. There are two types. First is the primary facial spaces, second is the secondary facial spaces. Primary facial spaces are that spaces which are involved directly by infection, and secondary facial spaces or space infection are that infection which occur due to primary facial space infection. Now in primary facial spaces or space infection, there are two types: maxillary primary spaces or space infection, secondary mandibular primary spaces. In maxillary there is canine space, buccal space and infratemporal space. In mandibular primary space infection there is a buccal space, submandibular space, sublingual space and submental space. In secondary space infection, facial space infection, there is the mesenteric space, pharyngeal space, pterygomandibular space and temporal space. Now come to each one detail. First is the maxillary primary spaces infection. First is the canine space. The space is canine. Now we will discuss space in table, causes of involvement and management. First is the canine space infection. In canine space infection, the cause of involvement is infection from maxillary canine. When the root is superior to origin of the levator anguli oris muscle and below the origin of the levator superioris muscle, mean the cause of involvement is infection from maxillary canine. The management is spontaneous drainage may occur just inferior to the medial canthus of the eye. Incision for drainage is performed intraorally at the mucobuccal fold in the canine region. Now come to the second space, which is the buccal space. In buccal space, infection from either from maxillary or mandibular posterior teeth in buccal space. When infection, because buccal space are common in both primary maxillary spaces or mandibular. Now the cause of involvement is infection from either the maxillary or mandibular posterior teeth. When infection erode the bone superior maxilla or inferior mandible to attachment of the buccinator muscle. When they erode through the bone and reach to the buccinator muscle, in that area there will be buccal space infection. Now in management, if neglected, may result in spontaneous drainage. Now incision can be intraoral or extraoral. In intraoral, to avoid injury the facial nerve and vessel, and for aesthetic reason we give intraoral incision. Horizontal incision is made through the mucosa of the cheek in the premolar to molar region. Avoid injury of the parotid duct. In extraoral incision, when intraoral access will not ensure adequate drainage. When we do extraoral incision, when intraoral access will not ensure adequate drainage, the incision is made approximately 2 cm below and parallel to the inferior border of the mandible. Now come to the infratemporal space. The cause of infection is infection of the upper third molar or local anesthesia injection with contaminated needle in area of tuberosity cause infratemporal space infection. The incision can be intraoral or extraoral. In intraoral, in the buccal vestibule between the upper third molar and coronar process, in extraoral incision in severe isthmus when patient cannot open the mouth, in the scalp along the hairline above zygomatic arch. Now come to the mandibular space infections. There is a submental, submandibular, one sublingual. First, submental. The cause of involvement is infection from lower incisor when the root are apical to the attachment of the mentellus muscle, or spread of infection from other anatomic spaces like submandibular space. The incision is extraoral incision only beneath and parallel to the inferior border of the chin. Look at the diagram. Now come to the submandibular. In submandibular infection, the cause of infection is infection from the lower molar when the root are apical to the attachment of the malleoid muscle, or spread of infection from the sublingual or submental spaces. Incision is extraoral incision only 2 cm below and parallel to the inferior border of the mandible. Means submandibular and submental space there is a only extraoral incision. Now come to the sublingual. Infection from mandibular teeth when the root is above attachment of the malleoid muscle, commonly premolar and postmolar, are spread to this space from other adjacent spaces like submandibular and pharyngeal. The incision is intraoral laterally along the Wharton duct. Now come to the secondary space infection which occur due to untreated primary space infection. In this, first is the mesenteric. The cause of involvement is the infection spread from the buccal space or from infection around the mandibular third molar, mean pericoronatus. Management is the intraoral incision that begin at the coronar process and run along the interior border of the ramus, and extraoral incision beneath the angle of the mandible. Now come to the pterygomandibular space. The cause of involvement infection from mandibular third molar, or infection from inferior alveolar dental nerve block, or from the sublingual and submedullary space infection. Management is intraoral incision on the mucosa over the coronoid process. Next is the temporal space infection. The cause of involvement is infection from infratemporal space. Management extraoral incision in the scalp along hairline above the zygomatic arch. Next is the lateral space infection. The infection from other the cause of involvement is the infection from other spaces, submandibular and pterygomandibular space. And the next is the retropharyngeal, which occur due to spread of lateral pharyngeal space infection, and management is same like lateral pharyngeal. Now the management is both lateral pharyngeal and retropharyngeal space infection, extraoral along the anterior border of the sternocleidomastoid muscle. Drainage may be performed intraorally, but it is difficult and risky because there is a great chance of aspiration of pus, especially if the procedure is carried out under general anesthesia. Now come to the last, which is the Ludwig angina, which MCQs was come in last in early March exam. Ludwig angina is caused by infection of the lower anterior teeth, especially if the apex is below the malleoid muscle. Bilateral involvement of submandibular, sublingual and submental space occur in the Ludwig angina. There is a bilateral involvement of submandibular, sublingual and submental space, and it is caused by infection of the lower anterior teeth. Clinically, there is a severe difficulty in breathing, swallowing, speaking. There will be fever, there will be elevated tongue, and this is the most common feature, which is the elevated tongue and difficulty in breathing, swallowing. Treatment include airway maintenance, tracheostomy, throat tracheostomy, drainage of all spaces, and administration of double regime of antibiotics. Incision are both extraoral and intraoral. Extraoral is the bilateral, parallel and medial to the inferior border of the mandible at the premolar and molar region. Intraoral is the parallel to the duct of the submandibular gland. This is all about space infection. Now, if you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.